What if I told you that a strange flare-up after CAR T therapy might actually be a sign of healing, not harm? CAR T-cell therapy, once a game-changer for cancer, is now breaking new ground in the world of autoimmune diseases. I'm talking about conditions like lupus systemic sclerosis and idiopathic inflammatory myopathies. Since Dr. Georg Schett's pioneering work in 2021, using CD19-targeted CAR T-cells to treat refractory lupus, the momentum has only built. Global trials are showing real promise long-term remission in patients where other treatments failed. But, as with any innovation, new questions pop up, and sometimes, new surprises. Enter LICATS, local immune effector cell-associated toxicity syndrome. It sounds dramatic, but hear me out. LICATS isn't the cytokine storm we dread in oncology. Instead, it's a localized, organ-specific inflammatory response that looks a lot like a disease flare, but biologically, it's something else. Let's dive into the data. In a recent study from Germany, researchers followed 39 patients with severe autoimmune disease getting CD19 CAR T therapy. Over 3 years, 77% of them experienced LICATS, mostly about 10 days after infusion, lasting around 11 days. Where did it show up? Skin was the top target, followed by kidneys and muscles, exactly where those patients' diseases had been most active before. The good news? Most of these episodes were mild. Only 3 needed a short hospital stay for observation. None needed ICU care. So, how do I know LICATS isn't just the disease coming back? Here's the key. LICATS only shows up during the B-cell aplasia phase, not when autoantibodies return. It spares healthy organs, there's no complement activation, and it disappears on its own or with minimal steroids. Contrast that with a true relapse. Very different pattern. The researchers have a couple of theories. One, that the rapid clearance of B cells triggers inflammatory cleanup by macrophages. 2, that tissue repair kicks in as immune complexes get cleared, and patients with lupus, who already struggle with cellular debris, might be especially prone to this. The takeaway? Don't mistake LICATS for relapse. If you do, you risk overtreating with immunosuppression, which could undermine the very benefits of CAR T. Instead, keep a close eye on the skin, kidneys, and muscles in those first few weeks after infusion. Maybe LICATS is the last storm before the calm, a sign that CAR T is doing its work at a fundamental tissue level. As CAR T therapy moves beyond cancer, we're seeing the immune system in action in ways we've never seen before. So, let's rethink what toxicity means, and maybe even what remission really looks like.